Hello, my name is Jana Kim and I'm a part of the MR Cancer Group at the Norwegian University of Science and Technology. I would like to give you an overview of our recent publication in the Journal of Magnetic Resonance Imaging, which is titled Multiparametric Characterization of Response to Anti-Angiogenic Therapy using USPIO Contrast-Enhanced MRI in combination with Dynamic Contrast-Enhanced MRI. The purpose of our study was to use the relatively novel iron oxide particles GEH-121333 and to test whether they can be used for measuring vascular response of tumors to the anti-angiogenic drug bevacizumab. With anti-angiogenic therapy, it is difficult to predict how a tumor will respond, which makes the development of suitable biomarkers for assessing response very important. Dynamic contrast-enhanced MRI, or DCE MRI, is one method used in the clinic to detect and characterize solid tumors. It uses gadolinium-based contrast agents to gain information about the perfusion and permeability of the vasculature. One parameter that is commonly reported, especially in clinical trials, is K-trans. Another MRI method for characterizing tumor blood vessels is steady-state susceptibility contrast, or SSC MRI, which is also commonly referred to as vessel size imaging. Here, ultrasmall superparamagnetic iron oxide nanoparticles are used as blood pool contrast agents, and from changes in R2 and R2 star relaxation rates, we can derive information about vascular morphology, such as blood volume, vessel size, and vessel density. While DCE MRI is used quite frequently in the clinic, SSC MRI has mostly been used in preclinical studies, and one reason for that could be the lack of clinically approved iron oxide contrast agents. To keep this presentation short, I will be showing only some highlights of our results, and I have picked out 3 of the main points that we have discussed in the paper. First, can response to bevacizumab be measured using SSC MRI? Second, which method can better separate treated from control tumors, SSC or DCE MRI? And third, can we use the USPIOs GH121333 to measure response using T1-weighted imaging? In the study, we used mice bearing human ovarian tumor xenografts on the hind leg. The treated group was treated twice with bevacizumab, while the control group received saline. SSC MRI was performed before and after treatment, and DCE MRI only after treatment. First, we investigated whether the response to bevacizumab can be measured using SSC MRI with GH121333. To answer this question, we compared the SSC results with histology. Histology showed that bevacizumab treatment reduced the vascularization of the tumors. We could indeed measure this using SSC MRI. The bottom figure shows the change in parameters from pre to post treatment. While there is little change in the control tumors, the treated tumors have significantly decreased delta R2, delta R2 star, and Q, which relate to blood volume and vessel density. The second question we wanted to answer was whether SSC MRI or DCE MRI can better distinguish between treated and control tumors. DCE MRI was only performed post-treatment, and here are some of the DCE parameters showing differences between treated and control groups after treatment. Overall, DCE MRI suggests that the treatment reduced perfusion and permeability of the tumor blood vessels. We then performed partial least squares discriminant analysis, or PLSDA, to test if DCE or SSC MRI better distinguished the treated from control tumors. It turned out that the sensitivity was the same for both, but that the specificity was higher for DCE MRI. The highest accuracy was achieved when the parameters from both methods were combined. The third question we wanted to answer was whether we can use GH121333 also for T1-weighted imaging. Compared to other USPIOs, GH121333 has a relatively low ratio of R2 over R1. At 7 Tesla, which was used in this study, this ratio increases, but relaxivities at 7 Tesla are rarely reported, so we were not able to compare this to other USPIOs. We measured R1 and R2 relaxation rates at several time points, and we found that their development over time is very similar. Importantly, it is possible to see a difference between the treated and controlled tumors in both R1 and R2 time courses. Interestingly, we found that both R1 and R2 were decreased in treated tumors 1 day after USPIO injection. This suggests a reduction in perfusion or vessel permeability and thus reduced USPIO accumulation already 1 day after treatment, even though the treatment was administered after GEH-121-333 was injected. And that means that changes in the vasculature must have occurred very soon after treatment. Our study concludes that SSC MRI using GEH-121-333 is sensitive to vascular changes. DCE MRI has slightly higher accuracy than SSC MRI, but SSC MRI is complementary, and a combination of DCE and SSC MRI parameters can increase accuracy. USPIO-induced changes in R1 correlate with changes in R2, which is indicating that GEH-121-333 may be useful also as a positive contrast agent. This was just a brief overview of the most important results. For more details, please refer to our paper published in JMRI. Thank you very much for your attention.